So, as we know, in around 1/3 of patients with an ischemic stroke, after the patients present to the hospital, we cannot find the cause of the stroke. And this is an important problem because we do not know how exactly to treat these patients so that to prevent future strokes. So in this work, we tried to explore the genetic architecture. So we dived into the genetics of a stroke of undetermined source in order to get hints about the underlying pathophysiological mechanisms that might increase the risk for cryptogenic stroke and which could point to potential either drug targets or preventive strategies for this group of patients. So we use data from a large genetic consortium from 16,000 stroke cases and 32,000 controls. Among them, around 4,500 patients had a stroke classified as of undetermined etiology after the patients completed their routine diagnostic workup. And then we explored the genetics of the patients and the genetics of controls and made comparisons to see if we can gain any insights into the pathophysiology of the disease. So the first important thing, we have a number of important findings. The first important thing is that we found a strong genetic overlap between stroke of undetermined source and strokes that we classify that we know their etiology. So, in particularly large-artery atherosclerotic stroke, cardioembolic stroke, and small vessel stroke. So in other words, the genetic background of stroke subtypes does not seem to respect our diagnostic criteria. So we believe that this points to a possibility that a large number, pretty fair number of cryptogenic stroke cases are simply underdiagnosed cases of the other determined stroke subtypes. So this is the first finding. The second finding was, the second thing we found was that when we explored the genetic predisposition to specific causes of stroke, and particularly atherosclerosis, atrial fibrillation, and cerebral small vessel disease, we found that genetic predisposition to carotid atherosclerosis is associated with a higher risk of cryptogenic stroke, which we wouldn't be expecting because usually patients with carotid atherosclerotic disease are having a kind of stroke called large-artery atherosclerotic. However, this means that subclinical or less severe forms of atherosclerosis can contribute to the risk of cryptogenic stroke. So I think this is the second major finding. And then the third major finding is that we tried to explore genetic predisposition to classical risk factors, but also to potential new therapeutic perspectives, and explored how this affects the risk of cryptogenic stroke. And there we had some interesting findings. Particularly, we found that genetic predisposition to classical vascular risk factors, specifically high blood pressure, diabetes, obesity, was associated with a higher risk of cryptogenic stroke. Again, highlighting the importance of dealing with these vascular risk factors among these patients. And furthermore, we found, as a finding of with more future implications, I would say, we found that specific inflammatory pathways, but also prothrombotic pathways, and particularly IL-6 signaling, MC1 signaling, and factor 11 were associated with cryptogenic stroke. All of them are pathways for which there are drugs currently in the development pipeline, and could be interesting to be explored in patients with cryptogenic stroke as potential secondary preventive strategies in future trials.